I think being asked to chair a guidelines task force entails much responsibility. Of course, in acute coronary syndromes in particular, there's a very large amount of evidence available. For example, we considered evidence from 936 manuscripts. There were more than 2,400 comments from reviewers that we had to consider. And I think leadership in this respect means gathering a good team, delegating responsibility to subject experts to dive into particular areas in more detail, and then to try to synthesize the recommendations together in a format that's easily digestible for the community. So again, that means having a central illustration, having clear display items and recommendation tables, having a central animation, working on quality indicators, and having a patient guideline. There's a large number of trials that are going to be presented over the course of the coming days. I'm particularly interested in the area of intravascular imaging and looking forward to having more data which may provide an answer in relation to should we be using intravascular imaging in a systematic manner, and it will also let us know if guidelines are in a position to be updated to perhaps provide a stronger degree of recommendation. There's also going to be a number of interesting studies on antithrombotic therapy, and these are eagerly awaited. And we're looking forward to some randomized trial data providing guidance on how to manage the sickest of the sick patients with acute coronary syndrome, which are those with cardiogenic shock, particularly whether mechanical circulatory support can be of assistance in managing those patients, because there are more and more data coming to light with this approach. In terms of education for cardiologists, we all choose the ways that we keep up to date. I mean, it's a mix. It's between keeping up to date on specialist websites, I think keeping up to date via conferences. It's a pleasure to be able to meet again in person for face-to-face educational sessions. I think reading your favorite cardiology journals continues to be an important way to digest information, and it's very hard to keep up to date now because of the sheer numbers of publications that are coming out on a continuous basis, and that's where hopefully guidelines fill a gap. They allow subject experts to do a deeper dive and to distill the messages from these important randomized clinical trials or meta-analysis, interpret them in the broader context of the strengths and the limitations of the individual trials and whether or not typical patients, for example, were represented, and then provide a succinct recommendation for the community. So I think there's multiple sources of information. We all realize how hard it is to keep up to date. There are certain old reliables, and I think they continue to remain journals and manuscripts and clinical practice guidelines.